Hello, and good morning, good afternoon, and good evening, in the words of the great Dr. Tedros. Um, Welcome to another episode of Coding with Christine Hall. I get to have my good friend Sonal Patel on today. Hi, Sonal, how are you?
Hey, Christine. Good, my friend. It's so good to be back. Good to see your sweet face.
Thank you. Today is National Peach Day.
It is.
Yeah,
Wow.
and
Peach Day.
I'm not a big peacher. Oh, although, wait, I have to back up. There is this Spanish cake, as you
Mm,
know,
mm.
chaha.
Chaha.
And right, didn't we have that in New York
Didn't we
together?
have that in New York? Yes, we
Yes,
did.
and it has peaches in it. And
Hmm.
so maybe in celebration of National Peach Day, I'm going to have a piece of chaha cake. I think, yeah, that's logical, right?
That sounds delicious. Yeah. I know there are these trucks that come by. They don't quite stop in Chicago. They stop just short of the Illinois border. I used to get on this trend of like finding the best quality fruits that are in season, and they get shipped from like Georgia, right? It's still the peach state, I believe. That's
Yeah.
what I grew up with is the states had their own fruits, right? And so, yeah, peaches are delightful. I've always loved peaches. Fresh, juicy, yummy.
Mm.
Maybe I'll make some peach sorbet or something today.
Oh, that sounds cool. Do you have one of those? I know we're getting totally off topic, but do you have one of those ninja ice cream
I
makers?
have those ice cream things. Yeah.
Love it.
Sorbet, icy, whatever
Oh,
functions. Yeah. Yeah.
that's
Super
incredible.
tasty.
Oh, I
Yeah.
have to get one. So we're going to talk today about, excuse me, the nervous system in CPT.
Yes. The nervous system set of codes, right? Yeah, I love, by the way, a shout out to you for focusing on CPT codes and the entire book and carving it out chapter by chapter. I think you're doing a great service to the industry and approaching it that way, right? A lot of approaches to the
Thank
different
you.
sections. There's definitely approaches to the nervous system sets of codes as well in terms of surgical approaches and procedures that are listed throughout the 60,000 set of codes here. So yeah, I love it.
Well, one of the things is I teach a lot, as you do, and students are kind of hesitant sometimes to read the CPT book. I get it. It's not the most fun. It's not like, um, whoever your favorite author is. I like Alice Hoffman. I think she's a pretty good author. It's not fun like that. But a lot of the codes that we use specifically in the nervous system, there's a lot of guidance in there. And I
Yeah.
often tell students, don't let the day of the test or don't let the day of whatever the chapter test, the certification, the final exam, don't let that day be the first day that you've seen some of this guidance. So a lot of guidance in CPT there. So I think it's just encouraging people to get in touch with your inner CPT book, right? Open it up on a Friday night with a nice glass of wine, spend some time together.
Lounge on your sofa with this monstrosity. Take it to the beach. It's still summer. Put it in your beach bag and
Okay, if you
lay out
insist.
a towel and read. I love it. I love my code book. I'm still the old school girl who, needs to rifle through those pages. But when I'm actually doing coding or the auditing, yes, I have to have things on the ebook, and I like that PDF, file or tab that I can just look
Mhm.
at on my computer. But yeah, you make a good point when it comes to students, how they have a tendency to, you know, scan information quickly, which I know you have to do with such a huge volume. But the details really are in those CPT guidelines, those parenthetical notes that are listed
Mhm.
throughout the 60,000 section. Um, each and every subset of codes within the 60,000 range has, really juicy tidbits that are, filtered throughout. And you're absolutely right. I think it's really important that people who are trying to pass a CPC exam or a CMC exam, they really do need to spend time on the nervous system, because there are definitely questions on those exams, both of them, that involve the nervous system, sets of CPT codes. So, yeah.
Well, one of the areas there, Sonal, that I think comes to mind when we talk about nervous system is facet joint injections. And I don't know about you, but it seems almost every single year they are revising guidance. There
Yep.
was one year that the guidance changed mid-year.
Yep.
And I know that for a lot of people, billing those facet injections was pretty difficult. And that's another area, though, that we also see those mutually unlikely edits. How many sets of facet joint injections is a particular payer going to cover? And is it a hard stop at 2 or 3 levels? Or can we do more than 2 or 3 levels, but are we going to have to appeal that? Right. I think there's a lot there that's been happening over the past few years. And you can't rely on old information. You've got to continuously look to see what guidance has changed, especially for, if you're in that particular industry, pain management, orthopedics,
Yep.
neurology. There's a lot of different types of specialties that all kind of touch into the nervous system there.
Absolutely. Yeah, that's really well said. Facet joint injections, on a side note, have been in the news for a very, very long time, specifically based on what you had stated. The complexity of the CPT code definition itself, right, has been changed over time.
Mm-hmm.
Each of the various sections throughout the country, all of the MAC regions, have their own LCD policies written up. They've changed over time. There are many, many OIG audits that go on with those particular sets of CPT codes for facet joint injections. And again, you also circle back to, there are so many specialties, so many surgeons that tiptoe into this 60,000 range of CPT codes, right, for the nervous system. Absolutely. And all of those providers have to be savvy in what's going on. Absolutely. Like you said, that mid-year change, right? Absolutely.
Yeah, you
Necessary,
mentioned.
because those definitions are always confusing. And you're right, in terms of the number of units, right? How many levels of the spine can we actually inject into? Yeah, absolutely. I love this particular section of CPT coding. I love it.
You hit it on the head with OIG. OIG has completed, I believe it's 6 of 8
Yes.
audits.
Yes.
Yep, on facet joint injections.
Yep.
So spinal pain management. Now, the other thing is pain management does do a lot with neurostimulators. And, sometimes that's the key. If you're suffering from chronic pain, maybe a neurostimulator. And so pain management and neuro, they kind of go hand in hand
Yeah.
with each other. Now, we had a little neuro scare in our house recently in the last few weeks. My husband started to have some really strange symptoms. So we had to go in and get a full neuro workup with CT and MRI scans, and an EEG was done. Now,
Mhm.
EEG comes from the medicine section. That was probably the least invasive of all the tests that they ran. Was just the monitoring of those brain waves to see how they work there. But I think coders need to remember, medicine section also is going to include certain tests that are not of a surgical nature, in the medicine section. So we need to look there as well.
Absolutely. Yeah, that's a great, great point. All of those nerve conduction tests, all of those types of codes are definitely in the medicine section. And they definitely pertain to the nervous system. So that's absolutely spot on. People who are new to the industry have to realize that 90,000 section of CPT, the medicine section, also contains a lot of applicable and pertinent sets of CPT codes that are relevant to this type of work. Absolutely. Well, I hope your husband is okay. Yeah, that's a
He is
nervous,
okay. He was
scare.
dehydrated.
Oh, dehydrated. Yeah,
Showed
yeah,
a lot of neuro symptoms,
for sure, for
and it was
sure.
pretty scary to see
Yes,
him all hooked up and being
yes.
monitored. And,
Yep.
we live in South Florida, so dehydration is a serious thing here in
Yeah.
South Florida. A lot of symptoms there that could
Yes.
be neuro, could be something else, and we just don't know.
That's absolutely right. Yeah. I know so many people who have had similar scares. Absolutely. And that's an area um, where our providers are really digging for an answer, right? Because there's so many symptoms that it can mimic, right? And you're
Mhm.
absolutely right. There's so much that could be happening to that patient. Yeah, absolutely, absolutely spot on. Yeah, the nervous system is completely complicated, complex, and all of the problems that can happen
Mhm.
for something as quote unquote as simple as being dehydrated, right? There's a lot of workup that they still need to do to
Yes.
see if there's nothing more serious actually happening. So, yeah.
We also had another little neuro scare with a friend of ours who he received a meningioma.
Okay.
So meningioma is like a type of tumor
Mhm.
that is 99% of the time not cancerous, but
Yeah.
particular tumor in his brain, in the meninges of the brain, was putting pressure on the nerve of the ear. And so it was causing tinnitus. It was
Mhm.
ringing of the ears. It was causing vertigo, dizzy spells he was having.
Yeah.
And a couple of things I thought was very interesting. One of the things is that in the nervous system, we have specific codes for radiation therapy that are carved out from the radiation section, because the radiation therapy that's given strictly to the brain, they have a combination code that is in the medicine section, because again, they were focusing specifically on the brain, not any other part of the body. From your eyes, ears down to the tips of your toes, that radiation therapy gets coded out of the radiation section, where you have your oncology visit,
Mhm.
you have your simulation, you have the dosage, the dosimetry, and then after all of those things happen, they put the patient through radiation therapy. But in the in the nervous section, if you're going to have radiation therapy to the brain, like my friend who had that um, meningioma, I always want to say hemangioma. Those are two totally different things. Meningioma. He had to have some radiotherapy to reduce the meningioma so that they could go in and remove it carefully. And I thought it was interesting that there was one CPT code that described that introduction to the oncologist, the simulation, the dosimetry, and the administrative treatment in one code. Because again, the radiology section has separate codes for each one of those activities. Not in neuro, it was all bundled together into one code. So I think it's important to know there's all these exceptions, and the
Yeah.
neuro system is no different. He did have that meningioma removed.
Removed.
There's
Oh,
absolutely nothing. He's got a
good.
cool little scar, and he's a bald guy, so he's
Awesome.
rocking the bald guy
Yeah.
scar.
Love it. Love it. Good, good,
Doing
good.
great, right?
Yeah.
Yeah, but very interesting how coding is different, but the same depending upon what organ, right?
That's right. Yeah, absolutely. You know, we don't have the ins and outs of what goes on behind the CPT editorial committee and what they do from year to year, right?
Mhm.
What their logic and their rationale is. But yeah, it's really important fact that you pointed out is that not all sections are treated the same either, right? So you really have to take time and focus in on certain chapters that you happen to be coding for or auditing for, or you're simply trying to maintain compliance for, right?
Mhm.
It's really, really important that, you know, it's not just cookie cutter across chapter to chapter. You have to pay attention to those small nuances that definitely go a long way. So, absolutely. I think this year, too, in 2024, I know we're ending the year soon here.
Mhm.
CPT will be issuing
Isn't that
their new
amazing?
2025 codes very, very shortly here. It's
Oh,
already the
oh,
end of August.
I'm waiting. I'm waiting. I'm so excited. I'm
Me
not gonna
too.
lie.
I'm
Ugh.
so excited to get the new codes. Hopefully, you know, end of September, we'll get an email that they've been issued. Soon thereafter, we'll get the books, the ebooks, everything. So, yeah, super excited. But I was saying, I think in 2024, we received, I think, a handful of new nervous system codes. And I believe they fall into that range that you had hinted on, the neurostimulators. So another group of codes, you know,
That's
that
8 new
we'll have
codes
to be
and
aware
4
of.
revised.
Yeah,
Yeah.
exactly. So it's
And again, a lot
fascinating.
of those were for the neurostimulators there,
Yep.
like we were talking earlier.
Yep.
And remembering that there's, anytime that we have these surgery codes where we're implanting, you're
Yes.
gonna have a series of codes that are gonna talk about um, the initial implant, maybe repositioning, maybe replacement, or maybe you got lucky and you're getting a full removal, right? And so those codes are specific to what is the intent. I think it's always important for us to remember in medicine and in the legal world, what's the intent?
That's
What
right.
did you intend to do?
That's right. Yeah, you brought up a great point there. Something that I love talking about. I've been talking about it for years. When it comes to this particular set of codes, the neurostimulator codes, I digress a little bit once
Mhm.
again, but there was always in the news. I'll be talking about tomorrow when my podcast drops, yet another case of a erroneous use of a neurostimulator code. Again, the 60,000 range of codes, they
Mhm.
pay out more, right? Because it's a surgical procedure. It requires an operating room, it requires anesthesia, it requires cutting, right? And
Mhm.
so
Mhm.
this particular case I'll be talking about tomorrow is a Styvex case where, again, it was something as simple as a auricular device, this acupuncture device that's basically taped onto the back of a patient's ear. A wonderful thing, but providers for a number of years have been misunderstanding the 60,000 range of CPT codes and appending this neurostimulator code onto claims. So again, they receive much more reimbursement for something as simple as a, auricular device that is taped on to the back of the ear. There is no cutting, there's no OR, there's no anesthesia, is done in the office. So
You
I
know,
digress, but these are very complicated codes, right? That our providers, practitioners have to understand the intent, like you were stating. What is the intent of this code, right? Why are you using it for the patient? So,
you hit it on the head there, Sonal. I'm seeing a lot of audits now that are on acupuncture services
mhm,
where providers are using the wrong codes.
yeah,
And a lot of times, the specialty societies will give a blanket advice. Here are different codes that may be used by our specialty for different types of services. And they may or may not be paid by certain payers. And I think that sometimes providers don't take that moment to do the research. Just hire a coder to come in,
Yes, please.
review your codes and services, and
Right.
see, are you reporting the correct codes? Not that you think you are, and not that you got paid so you feel that you're doing it right. Remember, if you're getting paid and you're not entitled to the money, you're going to have to give it back no matter what. It doesn't matter that they paid you. If I open my bank account and there's an extra $1,000 in there, it doesn't mean I can keep it just because it accidentally got deposited in my account, right? So I think providers need to remember, just because they paid you doesn't mean you get to keep the money. And unfortunately, we see these types of reviews many years after the fact.
Yeah.
So now we have 2, 3, 4 years of payments that have to go back. They don't belong to you. And just like you were saying, that was misunderstood, the definition, without researching further into either the CPT changes or into CPT assistant. That's a wonderful authoritative resource to see if that is truly the right code. What do they mean when they're using that? I had I know a little off topic, but I had another acupuncture recently that they were using the wrong set of codes. They were using a code from the musculoskeletal surgical section for a non-invasive procedure that would have been better coded out of the medicine section. And they were getting paid for it for a period of time, and now they're really upset that there's an overpayment that the payer is trying to get back. So that's a great advice. I think we should always have someone come in and take a look at our codes and look at the description of the code and beyond just what the advice is. Does that make sense?
That makes perfect sense, Christine. I think, yeah, you gave really good advice there. Our providers, I know a lot of them think they can understand the definition of CPT, but like you were stating, there's so much more information that as certified coders, compliance professionals like ourselves, we have access to much more information that supports all of the background, the meat of that particular CPT code, right? There's much more guidelines there. Like in these particular 2 instances that we just happened to talk about for acupuncture, right? And the neurostim, just based on those. Oh, and the facet joint injections also, right?
Yeah.
Those definitions have caused confusion and misunderstanding for years. But certified coding specialists, compliance professionals understand the nuances and all of the current changes that have taken effect, right? We can't rely on advice from someone who just comes pedaling in, ringing our doorbell, talking about this CPT code you should use. No, right? You have to seek out trusted resources, people who've been around the block, who understand where, cited authoritative resources lie. And those are the folks who can really help protect you, because like you stated a moment ago, yes, you'll get paid today, tomorrow, the next month. You will get promptly paid within 2 to 3 to 4 weeks. However, was that payment appropriate, right? And like we know, the payer audits take place later. They take place down the road, and if they happen to see a volume of erroneous, neurostimulators or facet joint injections, if they see this vast volume of incorrectness, they will go back and ask for a post-payment audit. And that's a dicey situation because you're fighting an uphill battle. Because again, all of your documentation, your intent, the medical necessity, all of that, has to be documented originally at that date of service way back when that occurred.
And I think it's important that we remind people that when you get a letter from a payer, from Medicare, you really need to reach out to your compliance professionals before you send the records, before you answer that. And within the allowed time, reach out to your compliance professionals so that they can help you answer these with the best information, the best response possible. A couple of the audits that I've worked on recently, we're coming in after the fact. We're coming in after the provider got the letter, submitted all the documentation. Unfortunately, the documentation didn't exactly paint the right picture, my friend. I love that.
Love this.
Paint the medical picture by Sonal Patel.
Drops tomorrow.
Yay! It didn't really give that information. So it prompted an overpayment, a large one. And unfortunately, now we're calling the healthcare attorney. Now the healthcare attorney is reaching out to the compliance professionals. And we're trying to do damage control that really could maybe, possibly, hopefully, all of those probes, they could have intervened prior to.
That's right.
This audit request, the overpayment request there. So I was even looking just recently, I was looking at that audit about facet joint injections that the OIG did. And what I found to be quite fascinating is one of the audits said that in a 12-month period that the OIG they identified $7.2 million in overpayments in 12 months. And
Shocking.
the only thing I'm thinking of is that means that if they've got to pay back $7.2 million, there's no Christmas bonus for the staff. There's no raises this year. They're going to have to work harder. I just hear all of when I say, I think of the person boots on the ground, right?
Right. Exactly.
Yeah.
No, that's a shocking figure.
That's funny. Betty made a comment. It is. And that's just one of the many audit reports on just facet joint injections. So again, importance of following those particular payers. And sometimes we do have circumstances. It's not the norm, but there are circumstances where we'll have a need that exceeds those limitations of how many joints can be addressed at one time. But remember that should always be the exception. The mutually unlikely edits are set there because that's what is industry standard, right? And so I think it's just, again, it's important that we take some time to review CPT, review the guidance within CPT, make sure that you've taken a look at some of the amazing definitions, parenthetical notes, look for audits that have happened, maybe even target, probe, and educate from your MAC. See what are they concerned with? What areas of concern? A lot of the MACs now even have check sheets, checklists for how to identify those requirements for submitting these codes for service. Does your documentation meet that information? Right? Like you said, meet it. I love that.
That's right, Christine. That's great advice. Yeah, the CMS, the MACs have done a great job, in my opinion, over these years in terms of really wanting to help our providers, our practitioners, right, by developing better tools for them to use, right, on the various MAC web pages. Like you stated, absolutely. Novitas is one of my favorites. They've always provided outstanding education materials on these documentation checklists. for the various types of service lines, especially in conjunction with the myriad of the TPEs that are going on currently throughout the country. There are so many. But if you just take the time to poke around those various MAC web pages, you can find really useful information that oftentimes does carry over from MAC to MAC, because usually if one MAC sees an issue, like with our evaluation and management services, I digress, but they're all looking at them currently, right?
Yes.
From 2021 because of the overhaul. So, but if you take the time and look, they each will have a documentation checklist, of what they expect based on these new guidelines, just for example. But yeah, that is great advice that our providers should take to heart, or have someone on your team, please. We know you're busy seeing patients, helping their treatment plans, help them meet their goals. But find those compliance professionals, those certified coders, let them join your team and help you maintain compliance here as we quickly approach the new CPT codes for 2025 that we will soon get our fingers on. Those books should be coming soon in the fall. So I'm excited.
I am too. I always like the new codes. I like learning about the new procedures.
Yes.
I think that's where a lot of us, if we're not in a particular specialty, it's when the new codes become available to us that we start to learn about where other specialties are growing. So that's really awesome. Sonal, we've reached our time already.
We did? Oh my goodness, time flew by.
It absolutely does. I can't thank you enough for joining me and giving us such wonderful insights on coding the neurology section of CPT. Sonal's information is below. SP Collaborative. Please reach out if she can help you with any of your needs. If you need to have a CPT review in your office, give Sonal a call. Let her take a look at these. She can tell you where you're leaving money on the table. She'll also be able to tell you where you have some risks and how to mitigate those risks so they disappear, right?
That's right.
Thank you so much, Sonal. Thank you, everyone, for joining us today. Have a wonderful week, and we'll see you again in 2 weeks.
Bye-bye.
Thanks for watching.